Thank you for joining us for the 47th Annual AAKP National Patient Meeting. My name is Kent Bressler, and I am an AAKP Board of Director and AAKP Ambassador for the state of Texas, and host of the podcast series, Kent's Kidney Stories. In addition to being a veteran and a retired nurse, I have also been a kidney patient for over 45 years. I'm grateful to have received a preemptive kidney transplant 35 years ago on April 30th, 1987, from my brother Kip. His donation allowed me to receive a transplant without ever having to go on long-term dialysis, which personally is one of the hopes for all of those suffering from kidney diseases, to transplant first. I am forever grateful for the selfless gift my brother has given me and my family. As co-founder of a nonprofit called Kidney Solutions, this organization provides mentorship to individuals seeking a living kidney donor, and all services provided by Kidney Solutions are free. I have also worked closely with the members, staff, and board of the AAKP and have had the pleasure of podcasting many of their stories. I am also an active part of the AAKP's Veterans Health Initiative, supporting the unique needs of this kidney patient population. It is critical that, as patients, we raise our voice and become the leader of our own healthcare team, to demand access to the latest innovations in treatment options and devices that are available, and to ensure true shared decision-making starts and ends with us, the patient. This is why I am so pleased to moderate today's session titled Preparing for a Kidney Transplant. As preemptive transplant recipient myself, I'm a passionate believer about transplant first. However, knowing that may not always be the option for every individual suffering from kidney disease. Every individual who is interested in pursuing a transplant should be supported by their healthcare team in achieving that goal. Today we have with us a friend and ally of AAKP, Dr. Rohan Paul. Dr. Paul is a transplant nephrologist with Washington University in St. Louis and the George Washington Transplant Institute in Washington, D.C. He is a clinician, an NKF-funded translator researcher, and a patient advocate. Dr. Paul is also a member of the American Society of Transplantation's Public Policy Work Group and is committed to promoting kidney patient choice and transplant access in partnership with the AAKP, government, and other stakeholders. Dr. Paul, I now turn it over to you.
Thank you, Mr. Bressler, for the very kind introduction. And again, I want to thank Mr. Paul Conway, Ms. Diana Kleins, and the AAKP for inviting me to present this session, which is about preparing for a kidney transplant. And like my previous talk on preparing for going to the emergency room, this is a very pragmatic presentation, which is primarily intended for patients, families, and caregivers, and contains a few points for people who are involved in the policy realm. So I have no disclosures for this talk. And just by way of background, I want to start off with a few words about kidney transplantation and to put transplant into context for the sake of this particular talk. Kidney transplant is widely accepted as an attractive therapy for certain patients with kidney problems. It doesn't apply to everyone, but there is data from the last 30 years that supports kidney transplantation as a therapy for people with advanced kidney disease. And that's based on measures of quality of life and life expectancy. And that concept has been embraced by the medical community. And it's the reason that the kidney care choices model under CMS serves to incentivize kidney transplantation and improve access to KT, among the many other agendas that it serves. And while improving access to kidney transplant is desirable, it does underscore the need for timely knowledge and preparation by kidney patients and their caregivers. And what I mean by that is that now that kidney transplantation is going to be more readily available, or at least we hope it moves in that direction, we're going to find that the ball is more in the court of patients and consumers, which is where it should be. But with that comes the responsibility to be more knowledgeable and informed. And what does it mean to be an informed and knowledgeable kidney patient? First of all, remember that kidney conditions are common and that you are not alone. And this is a point that I emphasized in my previous talk, which is that over 1 in 7 people have some form of kidney disease. But understanding your kidney condition is what gives you power over your kidney condition. So like I said in my previous talk, learn about your diagnosis, learn about why your nephrologist believes that you have kidney dysfunction, talk to your dialysis nurses and staff as to why you take certain medications and why you're expected to adhere to a certain diet, and talk to your social worker about affording medications if that's an issue or you have questions about that, and learn from fellow patients and from people in the AAKP about what it means to have a diagnosis of kidney disease. But at the same time, be true to your aspirations, which are the most important thing in the world. And what I mean by aspirations, these are things that matter to you. It could be a career goal. It could be graduating from school. It may be spending time with your grandchildren or traveling the world or walking a loved one down the aisle. Whatever it is, your aspirations is the most important thing. And your kidney condition and your medical conditions should be managed in such a way that you have every opportunity to realize your aspirations. So the point that I'm trying to make from this slide is take control of your health, your kidney health, for your own sake and for your own aspirations, and not for your doctor and not to satisfy your dialysis staff, because that's not what the point is. And with that said, you should also know that kidney transplantation is a choice or a therapeutic option. It is a choice, and a good choice, only if it is made after understanding your health condition and if it aligns with your aspirations. And the choice to pursue kidney transplantation is therefore very unique to each individual and deserves a thoughtful discussion with your family, your providers, and other people that are important to you. Now, in order to understand what's involved in getting evaluated and listed for a kidney transplant, it's easier to understand if you understand what it means to be a kidney transplant patient. Being a kidney transplant patient means having undergone an extensive operation to engraft a donor kidney from either a deceased donor or a living donor into your abdomen, as illustrated in this photograph of a young man who's had a kidney transplant. Since it's a major surgery, there is a recovery period, and that recovery period may take weeks, it may take months, depending on your age and other medical issues. And having a kidney transplant or being a kidney transplant patient also means taking lifelong medications religiously and regularly. And those medications can have side effects and they can have certain costs that you need to be aware of. And the other obligation, if you will, of being a kidney transplant patient is being ready to be frequently monitored to ensure that your kidney and your health is being managed appropriately. That means frequent doctor visits and frequent lab monitoring. So with that, it's no surprise that one would want to be in relatively stable medical condition before pursuing a kidney transplant operation. So you as a patient, if you're interested in getting a kidney transplant, you should want to have your heart evaluated to make sure that it's stable for you to undergo a major surgery. You should want to make sure that your other medical issues are addressed before undergoing a major clinical event. Given the fact that there's going to be a recovery period, you should want to have or muster social supports in anticipation of what you may need after in that recovery period. You should also want to be nutritionally stable. You should also want to know that your medications that you're currently taking are not going to interact or interfere with the transplant medications that you will need after your kidney transplantation. And then finally, you also will want to be sure that you can afford your medications, will be ready to deal with any financial costs that may be unforeseen after your transplant surgery. All of these aspects of transplant eligibility are intended to help you have the best chance of success after a kidney transplantation and not to simply make getting kidney transplant more challenging. But even with those concepts in mind, the journey to transplant can be complex and challenging. And starting the journey starts with, first of all, accepting and understanding your diagnosis. And by understanding your diagnosis means knowing why you have a deterioration in kidney function, understanding how that may be interfering with your health or how it may interfere with your health, and what you can do to stop it or to optimize your health. Because early diagnosis and treatment will give you the best chance to meet eligibility criteria for a kidney transplant by being medically stable. So reconciling with your kidney condition is always the first step towards getting a kidney transplant. Other challenges include concerns about work and insurance, lack of social support, maintaining emotional wellness through the workup towards a kidney transplant. Patients express concerns about not knowing how to access a transplant center and get on the wait list. And there are also uncertainties about the transplant evaluation that patients have also voiced. I'm going to touch on all of these so that hopefully the journey towards kidney transplantation is smoother if that's what you and your loved one elects to pursue. As far as insurance is concerned, kidney patients do have options which they may or may not realize. For instance, any patient with advanced kidney disease who's declared as having ESRD or end-stage renal disease meets Medicare eligibility regardless of their age, even if they're under 65. Under Medicare Part A, hospital cost is borne by Medicare, which means that it's free to the beneficiary. Having Part B means that 80% of your outpatient care is covered. That means doctor visits, lab visits, and that 80% also covers transplant medications, which many patients are not aware of. Typically, drugs are covered under Part D, but that does not apply to kidney transplant. And currently, and this is going to change in the future, but currently, if your only eligibility criteria for Medicare is being a kidney patient, then you will have coverage for 36 months under Part B for transplant medications. If you are over 65 or have another reason to qualify for Medicare, then your coverage will continue. But this thing is going to change, and I'll touch on that in a moment. And the other thing to point out is that in 2021, ESRD patients have the option of choosing a Medicare Advantage plan instead of original Medicare. And you also have the option to retain your commercial or employment-based insurance depending on your personal circumstances. And the thing which I was alluding to earlier, which is very exciting, is the Comprehensive Immunosuppressive Drug Coverage Act of 2020. What this means is that Part B will cover 80% of medications beyond 36 months, even if you're under 65. So if you're working and you lose employment and lose medical coverage because of that, having Medicare Part B continue means that at least you have a safety net to cover your immunosuppressive medications. This is yet to go into effect, possibly will happen in 2023, but it's something that's very exciting and is something that the AAKP and other stakeholders have played a critical role in, which is wonderful. Now, other uncertainties about navigating the system include how to get evaluated for a kidney transplant. First and foremost, it always begins with early kidney diagnosis and management. And if you are given the option or have the option of getting a transplant before needing to start dialysis, if your kidney function is below 20%, that's what you should ideally opt for, because preemptive transplant yields better outcomes for patients rather than having a transplant after initiating dialysis. But that's if you have that option. And other concerns by kidney patients who have been told that they have kidney dysfunction is getting access to a kidney specialist. Some people are, told by their primary care doctor that they have protein in their urine or their GFR is low, but they don't know who to see about it, let alone get access to a transplant center. Now that we know that people with advanced kidney disease qualify for Medicare, it means that patients with advanced kidney disease can search for a nephrologist that takes Medicare patients using the physician compare function in the medicare.gov website. You simply search for physician compare in the search box, and it will take you to a screen where you can search for a physician based on your zip code that takes Medicare. If you have commercial insurance, you can also search through your commercial insurance. And there are also other online platforms such as ZocDoc or similar systems that are private and don't bear any cost on patients, but are paid for by medical groups that use those services to help patients find doctors that will take their coverage. And in that same vein, it's also desirable to seek a referral to a cardiologist or a dentist that also takes your insurance, because most patients who need a kidney transplant do end up needing a cardiology and a dentistry evaluation before they can be listed. Now, once you establish care with a nephrologist through this process or through some other means, you'll want to be referred to a transplant center if you think that transplant might be a therapeutic option for you. The easiest thing is to simply ask your nephrologist to refer you to a local transplant center in your city or region. The other option you have is to look for a transplant center yourself. And for that, we have the SRTR website, which I'll show you in the next screen. The SRTR website allows you to search for transplant centers by entering an organ that you are seeking, followed by the zip code that you either live in or that you're willing to travel to get a kidney transplant. In this example, I typed in kidney and used the Washington, D.C. area code, and the system gave me 6 transplant programs in the vicinity of that zip code. As you can see, it summarizes each program by the number of transplants they do, by their geographical location, and it also gives some basic metrics on transplant performance that you can contrast and compare. And if you want more details, you can click on the links and it will give you more information about each individual transplant center. And if you want to seek evaluation at one of those centers or all of those centers, you have the option to click on another link which will take you to that transplant center's website and you can register for an evaluation. So once you've established care with a nephrologist and found a transplant center that's willing to see you, you'll typically get called for what's called a transplant evaluation. This can be an on-site or a virtual meeting with the entire transplant team. And when I say transplant team, I refer to the transplant nephrologist, the transplant surgeon, the pharmacist, the social worker, the dietitian, the financial officer, literally everyone who's going to be involved in your transplant journey if that's the course of action you take. And remember that the evaluation is a conversation. It is not a test or a trial. And it's a two-way opportunity. It is a chance for you to learn and decide if kidney transplant aligns with your aspirations, like we talked about earlier. And at the same time, it's an opportunity for the team to learn and ensure that kidney transplant is safe for you, and also to ensure that it has a realistic chance of meeting your aspirations, which is also equally as important. Now, the transplant evaluation is typically a very busy day with lots of people to meet, so it's important that you come well rested and you come with an open mind. If possible, bring a support person with you, because there's going to be a lot of information that's going to be difficult for you to remember, and it's good to have another person there to listen and take notes. And also, the other person may think of questions that you may not think of asking. Also consider family and friends who may have expressed a desire to donate. It's also important to know your medical history and your medications very well. If possible, bring medical records with you. In my previous talk, I talked about developing a folder that you can use to take to the emergency room that carries a summary of your medical history. That folder would work perfectly for a transplant evaluation. The transplant coordinators will love you. The transplant nephrologist will love you. I would love you if you brought that information with you to your evaluation, because it makes it easier for me and my team to get to know you and what your medical issues are, so that we can come up with the best plan to move forwards with your transplant evaluation and workup. Also, remember to ask lots of questions. This is your opportunity to learn about transplant in general, as well as the specifics about each individual transplant program. And just as importantly, don't assume anything. Even if you've been declined for transplant in the past, things can always change, and things have changed. In prior years, people who are highly sensitized and unable to get a transplant because they had preclusive levels of donor-specific antibodies now have the option of enrolling in a desensitization program through centers like Johns Hopkins, Cedars-Sinai, among others, which means that it is still possible to get a transplant. So, like I said, come in with an open mind and you may be surprised. And like with my other talk on preparing for ER visits, this is a topic that also raises similar policy issues and really calls for early conversations with emphasis on patient aspirations and values, and not simply interventions that are anxiety-provoking and that are not patient-centric. So the same concept applies to the kidney transplant journey, which is that if we have conversations about kidney wellness and kidney choices early, so that we can plan and potentially pursue preemptive transplant rather than reactionary kidney transplant when people are already on dialysis, that will be better outcomes for patients, better outcomes for caregivers, and is also desirable from a system utilization standpoint. And so coming back to patients and their families, the take-home messages are it's important to reconcile your kidney condition, as that will be your first step towards getting evaluated for a kidney transplant or pursuing any other therapy that you may think will benefit you. Navigating towards kidney transplantation evaluation is complex, but there are tools and resources there to guide you. And hopefully with the resources that I pointed out in this particular presentation, that will be helpful. Also, remember that there are various insurance options available, and I was unable to go into detail given the time limits of this talk, but you should talk with your dialysis social worker or your transplant financial officer to get more information on what your financial options may be. And remember that a transplant evaluation is a conversation about you and your aspirations, but remember that it's also about the gift of life. Transplantation wouldn't be possible without the generosity of living donors, and it wouldn't be possible without the generosity and consideration of grieving families who've lost loved ones but are willing to give up their organs so that someone else can benefit. So when you come for your evaluation, come with a sense of gratitude, and that's something which will also be appreciated by the transplant team that take transplant very seriously, as you can probably imagine. So with that, I'll thank you again for your very kind attention. I hope that this has been helpful. And like with my last talk, I'm more than happy to take questions offline about any of the material that was presented. And I'm also happy to talk to people who are involved in policy about some of the elements that were brought up. So thank you again.
Thank you, Dr. Paul, for an excellent and important presentation. On behalf of the AAKP, I appreciate you sharing your time and expertise with us.